Welcome back to another exciting episode on this YouTube channel. I remain Reiki Agambo. I talk about anything drugs and your health. If you see me for the first time, you are welcome. And if you're a returning viewer, thank you for always stopping by. So today I want to talk about something that is common among women, and that is vaginal yeast infection. And from the topic I want to talk about, do antibiotics cause vaginal yeast infections in women? Let's establish some facts. So a vaginal yeast infection is a fungal infection that causes irritation, discharge, and intense itchiness of the vagina and the vulva. That's the tissues around the vaginal opening. It's also known as vaginal candidiasis or vaginal yeast infection. So the most indicated organism in a vaginal yeast infection is the fungus Candida albicans, even though there are other fungal agents or there are other fungus that causes this infection, but the most known culprit is the fungus Candida albicans. And usually symptoms can range from redness and swelling of the vulva, intense itchiness, as I said earlier, and a white, thick discharge with a cottage cheese appearance. And due to that fact, we want to establish whether antibiotics play a role in this infection or not. Usually in the vagina, there's a balanced mix of this organism, candida and bacteria. They are in a balanced mix or balanced level in the vagina, and they are beneficial. They usually occur naturally. They are beneficial. So this balance helps to prevent an overgrowth of either of these organisms. So a certain bacteria called lactobacillus is responsible for maintaining and preventing the overgrowth of this yeast in the vagina. So anything that disrupts this balance will result in an overgrowth of this yeast in the vagina. And we have so many things that poses as a risk factor for that can cause an overgrowth of this yeast in the vagina. And we have situations like pregnancy where there's an increase of estrogen levels, which supports the growth or overgrowth of the yeast. We have the use of contraceptives. We have uncontrolled diabetes. We have weakened immune situations like in HIV infections. And then we also have the use of antibiotics, and that's what I want to focus on in this video. So something to take note of also is that not all antibiotics cause yeast infections. So that when you are taking an antibiotic, you don't become afraid that I hope I will not have a yeast infection. No, not all antibiotics cause yeast infection. Most antibiotics that cause yeast infections are usually broad spectrum antibiotics. So broad spectrum antibiotics are antibiotics that cover a wide range of bacteria. They inhibit and kill a wide range of bacteria, and even healthy bacteria can also be affected by this broad spectrum bacteria. Usually yeast infection occurs in about 3 out of 4 women, sorry, will experience a yeast infection in their lifetime. Usually yeast infections also are very common in women of reproductive age, but it has not been established that yeast infection is sexually transmitted. So yeast infection is not sexually transmitted, but it's more common in women of reproductive age, and it can occur at any age, but mostly seen in women in their reproductive ages. So now, since I said not all antibiotics cause the yeast infection, only broad spectrum antibiotics. So let's talk about or give a few examples of the broad spectrum antibiotics that cause this yeast infection. So we have the broad spectrum penicillins. Examples are the ampicillin and the amoxicillin. We have another class, which are the quinolones, where we have ciprofloxacin and levofloxacin. We have another class, which are the tetracyclines. We have doxycycline and minocycline. So in the event where you're exposed to these antibiotics, there's a chance that you can develop a yeast infection. This doesn't always happen in every situation, but peradventure you have these symptoms, you can check in with your healthcare provider or healthcare professional and find the needed help and guidance you need. I hope you find this helpful and useful to you, and I'll see you in the next one. Bye for now.